Hello, my name is Ana Belen Herrera. Study odontology. My topic about is periodontal disease complication. Definition: periodontitis, also called gum disease, is a serious gum infection that damages the soft tissues and without treatment can destroy the bone that supports your teeth. Periodontitis can cause teeth to loosen or lead to tooth loss. Periodontitis is common but rarely preventable. It's usually the result of poor oral hygiene, brushing at least twice a day, flossing daily, and getting regular dental checkups can greatly improve your chance of successful treatment for periodontitis and can also reduce your chance of developing it.
Gum
Gum
disease, or
disease, or
periodontitis, is
periodontitis, is
present in
present in
75% of the
75% of the
adult
adult
population and
population
can
and can
exist in
exist in
varying
varying
stages of
stages of
severity.
severity.
The
The
presence of
presence
gum
of gum
disease is
disease is
determined during
determined
a
during a
routine
routine
periodontal
periodontal
exam,
exam,
which
which
includes a
includes a
gentle
gentle
probing of the
probing of the
area
area
between
between
teeth and
teeth and
gums,
gums,
or
or
gum
gum
pocket, to
pocket, to
measure the
measure the
depth of the
depth of the
pocket.
pocket.
The
The
deeper the
deeper the
measurement, the
measurement,
more
the more
severe the
severe the
infection.
infection.
Healthy teeth
Healthy
and
teeth and
gums are
gums are
indicated by a
indicated by a
pocket
pocket
depth of
depth of
1 to
1
3
to 3
millimeters, with
millimeters,
no
with no
bleeding or
bleeding or
sensitivity.
sensitivity.
Healthy
Healthy
gums will
gums will
appear
appear
pink in
pink in
color,
color,
and
and
gum
gum
tissue
tissue
closely
closely
hugs the
hugs the
teeth.
teeth.
Stage
Stage
2 is in
2
the
is in the
early
early
onset of
onset
gum
of gum
disease,
disease,
known as
known as
gingivitis,
gingivitis,
and is
and is
indicated by
indicated by
pocket
pocket
depths of
depths of
3 to
3 to
4
4
millimeters.
millimeters.
Gingivitis is
Gingivitis is
caused when
caused when
bacteria
bacteria
start to
start to
multiply
multiply
within the
within the
plaque
plaque
and
and
build up
build
on the
up on the
surface of the
surface of the
teeth,
teeth,
causing
causing
red and
red and
slightly
slightly
inflamed
inflamed
infected gum
infected gum
tissue.
tissue.
If
If
gingivitis goes
gingivitis goes
untreated, the
untreated, the
condition may
condition may
advance to
advance to
stage
stage
3,
3,
a more
a more
aggressive
aggressive
form of the
form of the
disease.
disease.
Symptoms
Symptoms
become more
become more
visible with
visible with
tender,
tender,
swollen
swollen
gums that
gums that
bleed
bleed
easily.
easily.
Pocket
Pocket
depths can
depths
reach
can reach
5 to
5 to
7
7
millimeters.
millimeters.
In
In
stage
stage
3,
3,
bacteria
bacteria
multiply,
multiply,
invade the
invade
gum
the gum
tissue, and
tissue, and
spread to the
spread to the
underlying
underlying
bone that
bone that
supports the
supports the
teeth.
teeth.
Gums may
Gums may
bleed when
bleed when
probed and
probed
may
and may
appear
appear
swollen.
swollen.
Recommended
Recommended
treatments may
treatments may
include
include
scaling and
scaling
root
and root
planing,
planing,
a type
a
of
type of
deep
deep
cleaning that
cleaning
goes
that goes
below the
below
gum
the gum
line where
line where
bacteria
bacteria
like to
like to
hide,
hide,
and a
and a
locally
locally
delivered
delivered
antibiotic
antibiotic
such as
such as
Arrestin
Arrestin
that will
that will
continue to
continue to
fight the
fight the
infection and
infection
allow
and
the
allow the
gum
gum
tissue to
tissue to
heal.
heal.
As gum
As gum
disease
disease
advances to
advances to
stage
stage
4,
4,
pocket
pocket
depths
depths
increase to
increase to
8 to
8 to
9
9
millimeters or
millimeters or
more,
more,
and
and
further
further
deterioration of
deterioration of
teeth and
teeth and
surrounding
surrounding
bone
bone
occurs.
occurs.
Teeth will
Teeth will
become
become
loose, and
loose, and
roots will
roots will
become
become
exposed as
exposed as
further
further
bone is
bone is
lost.
lost.
Bacteria and their
Bacteria and their
toxins will
toxins will
now
now
invade the
invade the
blood
blood
vessels in the
vessels in the
gum
gum
tissue and
tissue and
travel to
travel to
vital
vital
organs.
organs.
In
In
addition to
addition to
scaling and
scaling
root
and root
planing and an
planing and an
application of a
application of a
local
local
antibiotic,
antibiotic,
some
some
teeth may
teeth
need
may
to be
need to be
extracted,
extracted,
and a
and a
consultation with a
consultation with a
periodontist or
periodontist or
gum
gum
specialist may
specialist
be
may be
scheduled for
scheduled for
further
further
regenerative
regenerative
procedures.
procedures.
In
In
all
all
cases,
cases,
gum
gum
disease is a
disease is a
treatable
treatable
condition
condition
and, if
and, if
detected
detected
early
early
on,
on,
can be
can be
reversed with
reversed
good
with good
patient home
patient home
care and
care and
periodic
periodic
recall
recall
visits.
visits.
The more
The more
advanced
advanced
forms of
forms
gum
of gum
disease
disease
cannot be
cannot be
fully
fully
reversed,
reversed,
and
and
treatment
treatment
becomes
becomes
costly and
costly and
time-consuming.
time-consuming.
Your
Your
doctor will
doctor will
recommend the
recommend the
most
most
effective
effective
course of
course of
treatment for
treatment
your
for your
particular
particular
condition.
condition.
Total
Total
oral
oral
health
health
care
care
begins at
begins at
home.
home.
Your
Your
doctor can
doctor can
suggest
suggest
professional
professional
quality
quality
home
home
care
care
tools that
tools.
will
Application is odontology. Treatment may be performed by a periodontitis, a dentist, or a dental hygienist. The goal of periodontitis treatment is to thoroughly clean the punctures around teeth and prevent damage to surrounding bone. You have the best chance of successful treatment when you also adopt a daily routine of good oral care, manage health conditions that may impact dental health, and stop tobacco use.
to mineralize, forming hardened deposits called calculus, which can only be removed with dental instruments. In response to the increased bacteria adjacent to the soft gingiva, the body sends immune cells and healing cells to the area by way of the circulation. The increased blood flow to the gingiva produces red, enlarged, and tender gum tissues, a reversible condition known as gingivitis, in which the periodontal attachment fibers remain intact. Continuous exposure to acids and enzymes from plaque bacteria and the body's immune response to them eventually causes the periodontal attachment to be lost, an irreversible condition known as periodontitis. The sulcus depth increases to the point where the patient can no longer effectively remove plaque, leading to the destruction of tooth-supporting bone. Smoking impairs blood flow and can significantly interfere with a patient's ability to fight the bacterial infection. Other factors may be involved. Generalized periodontitis affects all of the teeth. They may loosen, appear unnaturally long and unattractive, and may ultimately be lost. When multiple back teeth are lost, the front teeth may be unable to support closing forces of the jaw muscles. They begin to tip and move. The cheeks begin to collapse inward where the back teeth are missing, and the lack of proper support for the jaw joints may cause them to ache, pop, and click. Periodontal bacteria can enter the body's circulatory system through leaky blood vessels. Once inside, the bacteria can lead to blood clots and inflamed vessels, which constrict in diameter, leading to strokes, heart disease, heart attacks, and poor circulation in the extremities. Periodontal
Pros and cons. Pros of deep cleaning: stop gum disease, fights bad breath, protects roots of teeth, promotes healthy gums, prevents tooth loss. Cons of deep cleaning: slight pain and sensitivity, can cause gum recession, risk of infection after the produce. In very rare cases, a risk of the nerve damage.
You probably brush your teeth every day, but how often do you floss? If you don't floss regularly, you're not alone. Still, it's important to get in the habit of cleaning between your teeth so you can keep your gums in good shape.
Healthy gums should be pink and firm and shouldn't bleed when brushed. Red, swollen, or bleeding gums may be a sign of periodontal disease, also known as gum disease. Other signs of gum disease include bad breath that won't go away, or pain when chewing. Gum disease is an infection that can damage your gums and the bones that hold teeth in place. It can be mild or severe. The mild form can be reversed with brushing and flossing. In the worst cases, though, it can lead to the breakdown of gum tissue and bone that support your teeth. This can lead to loose teeth and even tooth loss. If you have symptoms, see a dentist. To diagnose gum disease, the dentist will examine your gums for inflammation and will also use a tiny probe to measure any pockets between teeth and gums. He or she may also take an X-ray to see whether there is a loss of bone that holds teeth in place. The exam and X-ray are painless. Treatment will depend on the severity of your gum disease. One treatment is a deep cleaning called scaling and root planing, in which hardened dental plaque or tartar is removed from above and below the gum line. Medications may be used with scaling and root planing and can include a pill you take by mouth or a mouthwash. A dentist may also place medications in the pockets between teeth and gums. Although medications can be helpful, if your gum disease is severe, surgery might be necessary. Gum surgery allows the dentist to remove tartar from very deep pockets. The dentist then puts the gums back in place with stitches. At NIH's National Institute of Dental and Craniofacial Research, we support research that aims to help prevent, diagnose, and treat oral diseases, including gum disease. Scientists are looking for genes involving gum disease, testing possible new treatments, and studying how immune system glitches may lead to problems in the mouth, including gum disease.
Our
Our
mission is
mission
to
is to
improve the
improve the
nation's oral
nation's oral
health
health
through
through
research.
research.
We want
We want
all
all
Americans to
Americans to
enjoy a
enjoy a
healthy
healthy
mouth
mouth
for a
for a
lifetime.
lifetime.
Jesus applied in Ecuador. Periodontal disease are a group infection disease that mainly include gingivitis and periodontitis. Gingivitis is the most prevalent form of periodontal disease in subjects of all age, include children and adolescents. Less frequent types of periodontal disease include aggressive periodontitis, acute necrotizing ulcerative gingivitis, and various diseases of herpes viral, and fungal origin. This review aimed uh, to retrieve relevant information from Latin America of the prevalence of periodontal disease among children and adolescents of the region. Conclusions. In the most cases, the developing of periodontitis starts with plaque a stick film composed mainly of bacteria. If less underrated, here's how plaque and eventually advance to periodontitis. The best way to prevent periodontitis is to follow a program of good oral hygiene, one that you begin early and practice constantly throughout life. Thank you.